Today, I'm going to go through the essential steps that you should tick off when you're experiencing tinnitus. So, by that, I don't mean people who are experiencing tinnitus for a couple of seconds and then it dissipates on its own. Again, as I mentioned in an earlier video, that type of tinnitus is normal for everyone, not of significant concern. That's a stock standard biological process and mechanism in place. I'm referring to tinnitus that is lasting for most certainly more than a couple of seconds and days. Okay, days on end. And there's a big difference with that. So if you are in that category where you do have constant tinnitus and you're pretty new to this, the first step that you want to do is see an audiologist for a hearing assessment. And it's a full hearing assessment. It's not going to your GP to have a look in your ears simply to see if there's anything blocking the ears. That helps, but the audiologist will do that anyway. That's the first step that we do all of the time. We do otoscopy. That's what it's called, where we put the little torch inside your ear canal and check out what's the deal there, and look at the eardrum and whatnot. So that will be done regardless in your audiology assessment. GPs, they're great, as we know, for many things, but when it comes to tinnitus, your path of action is really to get to an audiologist for a thorough hearing examination. That is your best port of call, and you're basically fast-tracking your progress, to management. So what we would be doing there is looking to see if there's anything occluding the ear canals, anything blocking the ear canals. I have to be careful because I always talk in audiological terms. So occluding is essentially anything blocking the canal space. If we do find that there is severe wax occlusion, again, another term, occlusion, wax blockage, then that could actually cause tinnitus in some cases if it's been there for a really long time. So we'd be looking at that. We'd also be doing a full hearing test. That will come up as a set of results where it is very clear if you've got a hearing loss, if it's a conductive hearing loss. So if there's a deterioration or damage in the middle ear pathway, then we can actually see that. If there is deterioration in the inner ear pathway, sensory neural pathway, so inner ear hair cells dying or breaking off, they don't regenerate. So that's called a permanent hearing loss. So we also know that a permanent hearing loss, a side effect of that is oftentimes tinnitus. So identifying that is really important as well. Then we look at tympanometry, which is another, I suppose, slang term, could be a pressure test. It'll actually feel like a bit of pressure in your ear when we're testing it. It's not painful. Again, standard procedure. And what we're doing is to double check that there's sometimes no fluid in the eardrum, or there's no perforation or hole in the tympanic membrane, which is, again, the medical term for eardrum. And making sure that that is all clear. Now, that does not rule out the more sinister pathologies in the auditory pathway. So, but that is certainly so. And by more sinister pathologies, I'm referring to retrocochlear pathology, basically tumours. Okay. We're always told never to mention the word tumours to a patient, but hey, I know all of you have been Googling anyway. So I'm here to say that, those things exist. They're rare, but they exist. And most typically when we do the full hearing assessment, there are certain patterns that we can see in the results which will flag whether that is actually a possibility for your case, and in which case we will refer you to an ENT to get that checked out even further, typically with an MRI. Tympanometry will also identify eustachian tube dysfunction, And that may manifest in symptoms such as a feeling of having blocked ears, or if you suffer from sinus issues or allergies, or even if you're simply about to get a cold or recovering from a cold, that will come up in your results too. And so just remember, I am speaking to you freestyle right now, so I haven't listed all of the ins and outs of every single test and, all of the possibilities. Certainly, I have spoken about the most important ones or the most probable things in this segment. And if you just think back to what I've just mentioned in this 5-minute space, you don't get this service at a GP appointment in terms of checking your hearing or auditory pathways at all. And so that's why it's really essential. If you've got tinnitus and it's lasting a couple of days, please just get to an audiologist. It is worth the money because you're going to have the facts printed out for you within the space of 60 minutes, as opposed to going to a general practitioner who isn't trained in the hearing space very much anyway. And then it's just going to be pass the parcel and hopefully you'll be referred on to an audiologist, which is actually where you need to go. After you've got the facts in place, the audiology facts in place, then you can go on to your ENT if you need to, or you might have recommendations from your audiologist to have a set of hearing aids if you do have a permanent hearing loss, or if you're experiencing significant anxiety in relation to the tinnitus, then tinnitus-specific CBT is truly one of the best pathways for you. And if you're experiencing neurological symptoms, then certainly going to a neurologist would be another wise referral point for you. And there are so many other multifaceted components to tinnitus. I do recommend you have a look through my other videos to learn more about that. So TMDs or jaw issues, disorders are also connected to tinnitus manifestation. And I have a video about that in my earlier episodes. And that's only one of them. But again, if you are experiencing tinnitus, first port of call is simply an audiologist appointment. From there on, then you can look at other avenues, but that is 100% your first step. And if you haven't got that first step in place, then there is no point in bothering with the other steps until you have that one in your hand and you actually know what you're dealing with.